Hi everybody, welcome to another installment of the Monday Moan with Una of Little O Nutrition. So today what I want to talk about is weight stigma. So often we refer to stigma as basically just treating people differently because of something about them. So we have stigma because of sexual orientation or religion or colour or ethnicity or whatever. Weight stigma specifically is about treating people with prejudice because they live in a fat body. And that is, we're learning more and more, really damaging for health. So what can it cause? It can cause low self-esteem, low self-worth, low self-confidence, depression, avoidance of seeking healthcare, increase in secret eating, increase in emotional eating, difficulty forming relationships and social isolation. And they're obviously really, really serious side effects of something that is actually very much ingrained in our society, even though over 2/3 of us are overweight or obese. So we're kind of damaging each other's health, right? So how does weight stigma show up in our society? Well, like I said, it's kind of ingrained in our society. So it can come from your friends, your family, or your colleagues. If you're not being stigmatized by those people, maybe you're one of the people contributing to weight stigma. We often have this mentality of cruel to be kind, and weight stigma doesn't work like that. So it was often thought in the past that if you told people they were fat and they should do something to change that, that would be kind of motivation for them to change their ways and be healthy and lose weight. Now, obviously, as we're learning more and more that dieting and weight loss attempts don't actually work, that's not really a cruel to be kind thing anymore, because telling them to lose weight and losing weight doesn't work. You're just being cruel to be cruel. But a lot of people who experience weight stigma say that it comes from people closest to them who basically are willing to say things about them, or it comes from flat out strangers on the street who say comments that they don't think the fat person has heard. And neither of those circumstances are okay. The other place it comes from people is through healthcare. So there's a lot of research coming out now where healthcare practitioners like GPs and nurses are kind of giving their opinion on, and they're being studied on how they treat fat patients versus kind of straight-sized or normal weight patients. And what the data tells us is that fat patients receive less time with healthcare professionals, particularly GP appointments are shorter. The GPs tend to report that they have less respect for those patients, and they are more likely to over-attribute healthcare issues and illnesses to weight compared with a normal patient. So an example would be you go to the doctor with a sore ankle, and if you're normal weight, the doctor might say, oh, here's a referral for a physiotherapist, that should sort that out, and here's some painkillers. Whereas if you are an obese or overweight patient, the doctor is far more likely to say, well, obviously that pain is because your body is carrying around all this extra weight. You should definitely lose weight and go on a diet. There's no point in me sending you to physio because it's a waste of blah, blah. That's the type of shit that is actually going on. And that's really why there is a reluctance among people in larger bodies to go and seek healthcare advice, because some report feeling embarrassed, some report feeling stressed or worried that that's going to be basically the whole conversation is going to be about their body and their weight, and they've heard it all before and they've tried all the diets, and what's the point of going there for that if they're not going to actually improve their health? And then the other thing to talk about is the actual environment that we live in. So simple things are not that simple for people in larger bodies all the time. So example number one would be clothes. How many of your favourite shops stock, only up until a size maybe 18 or 20? Or maybe they don't even stock lower sizes, which is still stigmatizing based on weight, if they don't carry below a size 8 or whatever. And that's something that you really don't notice unless you have heard from or are somebody in a larger body who has had to try and shop for clothes. Another example is gyms. They often don't accommodate larger bodies' gym equipment. So, you know, that might be a reason that you're not seeing very large people in the gym if they can't use the facilities. It's not very helpful, is it? You also have that issue then with chairs. It's very commonly reported as well as another barrier to healthcare, because the seating in waiting rooms in hospitals, GP practices, etc. has arms that make it difficult for certain sizes to fit in. And they're just things, again, that you don't necessarily think of if they're not something you have to be worried about. And that's a privilege that you have because of the body you were born with. And I'm not going to say that I'm the final word on weight stigma because I haven't really experienced it. And that's something for us all to think about, because if you have not been stigmatized because of your weight, then you don't really know the full story. Yes, I have had comments made about my body before in relation to weight, but I know that I am straight sized, and I go home and I tell myself, well, that person was just an idiot. But I can still go to almost any clothes shop and buy something that I like and that fits me. I can go comfortably on public transport and know that I'll fit in the seats. I know I can go to my doctor about a sore throat and he won't bring up my weight or my exercise and anything like that. And that is privilege. That is privilege because I am white and thin. So when you hear about thin privilege, that's really what it's referring to. Because yes, we can all experience stigma, but unless it's actually true to the body that you're stuck in all the time, you don't really know the full effects of it. And that's really what I wanted to talk about today. So I have loads more content coming on weight stigma because the research is so compelling and so interesting, I can't stop reading it. And also because the more we know about it as a population, the more we can do to change the environment that we have at the moment and be more accepting of every body, and the more we can start to facilitate livelihoods for people in every size body rather than the kind of thin ideal. So hope you enjoy hearing about weight stigma. Talk to you soon. Bye.